Hello. Welcome back to another episode of Ask the Doctor with Dr. Jeffrey Sherman. Hello, Dr. Sherman.
Hello there. How are you? Nice to be with you.
Today, we're here to talk about research and how patients should properly research scientific information or medical information before they see a doctor or whenever. Today, the COVID-19 statistics are as follows. It is November 12th, and there are 10.3 million cases of COVID-19 in the United States, and there's 241,000 deaths. And the death count is going to be looking very scary this winter because infection rates have been increasing by a lot. And there's also going to be a lot of people staying indoors during the winter, so things could get a little dicey. And that's why we're doing the show here for today, because we want to make sure that people know how to learn information on the internet, because the internet's a very dangerous place.
Yeah, there's a lot of potentially a lot of untrue or half-true stuff and misinformation, and need to fact check it in several different places. Your doctor's a good place to start.
Mm-hmm. And that's one thing that I would like to start off with, which is how could a patient do some kind of research before they see a doctor for an appointment, and how do the doctors I guess like or dislike patients that do some research on their own?
To be honest, most dislike it. I don't mind it. I let the patient know, I mean, the patient's going to do what they're going to do before coming in. You haven't met the patient, so
Right.
you're not going to, have contact with the patient to tell him or her to not research. The patient's kind of naturally inclined to do so, and that's fine. And in some cases, it can educate the patient a little bit, but more often than not, it can almost put a little bit of fear into the patient. They sort of read what's on the internet and what it may turn out to be they have or whatever, and fear strikes into the heart of the patient. They go to the doctor thinking that's what they've got, or they're going to have some complications, and it's hard to undo or unring that bell, So no matter how much reassurance the doctor gives, some patients are hard. But I give some credence to that. I hear what the patient has to say, and then I say, yeah, but then again, there's some other things out there too that are untrue. So, I reassure, we're doing our thing here in the office and with what we've got here. So don't always, take what you see on the internet as the gospel. And that's why I don't mind it, because sometimes the patient, there is correct information out there, and they could learn a couple things and present some good questions that, may not have otherwise been brought up, and it helps the patient's case going forward. So I don't mind it. There is a limit. There's a law of diminishing returns. The patients get too into it, then they're overrun with information that you got to sift through the true versus not true. So, just a healthy inquisitory search is not such a bad thing in my opinion.
And this actually this reminded me of something that is a phenomenon shown in psychology, which is where if someone learns the first thing that somebody learns about a topic, about anything, and they have no other knowledge before it, if that's the first thing they hear, it's the easiest thing for them to believe, because after all, you got nothing else to believe about whatever subject that it is.
Right. It's like the first thing they know, it sticks. There's nothing else to contradict it or nothing else to confuse them about it. So that first thing sticks, and then you spend the rest of the time, if it's incorrect, trying to disprove it, and it's very difficult to do that, as it's kind of stuck in the level cement there, and it's hard to pry that away.
Right. And the point of going to a doctor is to get expert advice to figure out what is wrong with you based on what you're feeling about your body. And so doing a little research ahead of time doesn't always have to be bad, but it can very easily be bad, just because doctors are trained in the expertise of learning information and studying and the scientific method
Right.
even.
And they have the experience and the data of their own experience to know what may be best versus the textbook, which is not one size fits all. And so the doctor's experience he has seen many sizes and will pick the outcome or the path based on his experience and the information particular to the patient's case, which is best for the patient. So not every symptom X means diagnosis Y and vice versa. So it's a big picture. The computer doesn't necessarily take that into account. You type in, mid-epigastric abdominal pain, and before you know it, a lot of things come up. But in the office, you can discuss the nature of that pain, how it relates to certain situations, and before you know it, you've weeded out a lot of things that the computer has spewed out at you.
Right, because the computer is filtering out by one factor at a time, it seems. If you just search where your pain is, then the computer is going to figure out everything that makes pain in that region.
Yeah.
However, there's other factors at play, such as what happens if you touch it, what did you do in the past, whatever time period.
Yeah.
So there's many factors at play that patients could be missing.
Eat last, or relation to meals, time of day, wake you up at night, things that the computer won't ask you, really. I know there's some interactive websites out there, but it's still not the same as the doctor across the desk from you.
We have a question from the chat. Should patients print out information that they find valuable?
I'm sorry, you broke up on that. What was that question again?
Should patients print out information that they find valuable?
Oh, absolutely. I mean, print it out from a website, from an article, and present it to the doctor. A good doctor will, not immediately dismiss that. I'm not saying bad doctors do that, but my point is, I welcome patient input and information that they perceive, and good questions come from that. So printing those things will help the patient recall or cite exactly what their concerns are, and it can be very helpful. A good doctor like me would say, oh yeah, that's smart of you to bring that up, but here's why I don't think that's what you have, as opposed to, you got it to the internet, that's horrible, get out of here. There's ways to do it, but it's still quite useful. And then some of that may be exactly pertaining to the patient's case. So keep that material, bring it to the doctor's office, and it'll get used appropriately, I believe. Yeah.
And of course, it's not like doctors don't use the internet. Of course, I would. You've said before how doctors actually kind of have their own niche part of searching online.
Yeah, the Medscape. Medscape comes to mind. I know there's a bunch of others for searching articles and journal articles and things, which is helpful for a particular question. But doctors also have their websites to look up quick tidbit facts, doses of medicines, or is this good in this situation, or side effects, or case reports of certain things that may have popped up. So there's the journal search and the regular search. Medscape's a good journal search, and I'm blanking on the other one or two I've used, but they are quite helpful in terms of specific questions. And then there's the other general medical questions that you can pick up online. And the doctors know how to weed out the good information from the bad.
Yeah. And in fact, what do you feel is the biggest mistake that patients can make when they're researching symptoms?
I think it's just type in the list of symptoms, or what do I have if I have this, or like that. Click the first item that comes up on the search, read that, and convince themselves that they've got whatever that is. It's a multi-step process to diagnosis, one that's best done in the doctor's office. So coming in with a predetermined diagnosis based on an internet search, not the smartest, not totally unproductive, but can be a little challenging to unring the bell that the patient has done by doing that once the office visit is underway and concludes.
Right. And in this sometimes heated COVID-19 environment, can patients or anybody use Medscape to search for COVID-19 scientific articles?
Yeah, anybody, I believe so. It's not a membership type thing, but these articles are geared toward medical professionals and the studies and the clinical trials are geared toward medical professionals. There are some opinion articles that may pop up on the search, or follow-up summary articles that aren't exactly trials that may be suitable for the general healthcare consumer. But generally, Medscape is like trials that a non-physician or a non-medical person may find a little confusing with some of the terms that are used: p-value, sensitivity, specificity, predictive positive value, and things that are going to be in those reports that get a little bit confusing and only really means something to nerds like us.
Right. We have I think a very good question from the chat. What do you think of medical prescription commercials that we see so often?
Those are good. Those are good. Now they're laid out in the general, I guess, common denominator, because you're going out on a TV to a general audience.
Right.
So it's giving you, like, if you've got this, maybe you should ask your doctor about this medicine. And the key is they list a bunch of side effects, but that they're effective for the reason they basically stimulate the brain of the patient. Then they ask the doctor, and then the doctor will say yes, no, why, or why not. And then that would, but I think it's a good idea to bring awareness to the patient. They can, because they'll ask the right question based on that. And it can be helpful. And it's up to the doctor to delineate what's best for the patient in terms of prescriptions and medications,
Right. Yeah. Of course, it's an advertisement. So it's not, and it's like you said, it's to the common denominator. So it's not trying to be super scientific, because that just won't work for the purpose they're trying to achieve. And that actually reminds me about a lot of, whenever you try to search a medical question online, a lot of options that come up are going to be blogs, or are going to be not exactly websites from huge research companies or universities. So it's one important thing to remember is that having a blog or having a news thing, ultimately it's a business, which means that they want people to click on it and see the advertisements. That's just how it works. So they might give, like you said at the beginning, half-truths, where they do say something that's true and then something else that's going to grab your attention for the purposes of, making money, because they have to survive. There's a lot of competition out there. And it's just important that people realize that, so that they don't take it as doctrine. They can just, however, those articles can be very useful for outreaching to people, to give them tidbits of information about things that then they can research into. And like you said with Medscape, if a person is more interested, they do have websites that can help them get into scientific research, or they can ask their doctor about it.
Right. And that's and believe it or not, that triggers some obviously it triggers business, or else it wouldn't continue, because the patient can stimulate the dialogue in the office, and give the physicians something to think about. But physicians are on the ball. They know about the medicines that are out there, but it just makes the patient more aware of their medical condition. It helps them ask some of the right questions when in the office. So it doesn't always necessarily. I mean, it's a good thing because it brings attention to the medication, but it just brings attention to the whole medical problem the patient has, and they can become more educated by asking about that medicine. And the doctor will say, no, I don't think so because of reason X, or maybe, yeah, that's a good idea because you do qualify for that. So it can help the patient learn not only about the treatment, but just generally of their medical issue by bringing up questions about that.
That's right. And because COVID-19 is such a developing subject, such a developing crisis, the information that's available out there can be very hard to find because it's so new. And there's also, because it's also a new crisis, a new topic, it's also news. So it can be very hard to find the scientific journal, and it's a lot easier to find all of the various news sources, big or small, that use the articles for your entertainment or information, regardless. So in the current climate, how should people best learn about current COVID-19 conditions?
I know it may be above people's heads in some cases, but they do a pretty good job, and that's the Johns Hopkins newsletter, which gives the statistics, and the statistics both globally and domestically. It gives, it can break it down in as much detail as the patient wants. It was daily. It stopped being daily. Maybe it's going to be daily again with the numbers rising. But the Johns Hopkins newsletter is pretty good in terms of statistics and where the pandemic is boiling up and where it's better and why. That's a good source. And you just, Google Johns Hopkins, you can get the newsletter, and you can click on, add me to the daily mailing list or add me to the mailing list, and they'll send it to you whenever they send out the mass email. Just the local, the LA County website, the .gov website is good about the details about County of Los Angeles and nearby counties and statistics about that. A little bit more local. The Hopkins is a little bit more widespread,
right.
But the County of LA website has good information on it. I still read the LA Times newspaper, and the actual newspaper every morning. I mean, the article will be outdated by the end of the day, but the morning paper has been really good keeping, numbers and people up to date. They use some charts and graphs at times, but they have some insight, and they have some good sources there to kind of give us information that is pretty good. You can go on latimes.com and see the morning paper too. But my point is, there's the more global national site in Hopkins, and then the LA County website for the more local. Those are pretty good sources. And the paper, of course. Yeah, LA Times.
Yes. And for other international researches, or not researches, for other international information, the World Health Organization is probably a very good site for such things because, well, they are the global organization of countries. And because of the fact that it's a bunch of countries together, it's less likely that an international organization is going to have some kind of bias or bureaucracy in their corresponding countries. I'm not saying Johns Hopkins is bad or anything. It's just that it's always good to have multiple sources of information because, you want to kind of make sure you get a full pallet. Because sometimes
you'll see more of the international stuff on that World Health Organization source. Hopkins has some, not as much as the WHO. But yeah, you can cross check your facts, and go from there and see. But these are pretty up and up sites. I don't think they're trying to hide anything. They just need to put out the facts. These are Hopkins, WHO. They're all good sources of information. I think it's good to kind of look at both of them.
I mean, this pandemic is a big deal if it's not been clear enough. One fascinating thing that I learned today was a little bit of history. Back in the 1918 Spanish flu pandemic, the results of that pandemic, the flu from that pandemic evolved into the seasonal flu that we have now.
Yeah.
Apparently, the seasonal flu that we have now actually resulted from the previous flu pandemic that we had 100 years ago. And so I guess that kind of suggests that this COVID-19 disease has the capability of being a seasonal problem across the world. And that's also why it's so important to get the most effective vaccine possible.
Yeah. So you're saying the symptoms of the Spanish flu were
a lot more severe.
Were worse than what the seasonal flu is now. But, if you're saying that evolved into the seasonal flu, I've been saying all along that if we can get this COVID into what the statistics are and even the symptoms of the seasonal flu, it's a win. I mean, we deal with the flu. Let's get the statistics of COVID to what the statistics of the flu are. And we don't have to worry about it with the help of a vaccine, with help of treatments and therapies, of course. But and that'd be interesting that happened. And I would not be surprised if something similar with this one happened the same way.
And the flu,
that evolution of how the symptoms and the just the overall epidemiology of it.
That's right. And 100 years ago, the flu even came from birds. You might have heard something called the bird flu. So I think that's also very interesting how these diseases that we deal with actually seem to have always originated from animals or from other animals, but not always.
And it didn't come from Spain either. It was renamed the Spanish for another reason. I used to know why, but I know it didn't come from Spain. And the Spaniards were a little bit pissed about that name, or a little upset about that name, I should say. And,
that's fair.
But it really didn't come from Spain. You're right. It came from a bird from somewhere. And the link to Spanish flu is some other roundabout, nomenclature technique.
And this was just to warn people that this disease could be a permanent thing. It probably won't be a permanent thing with mask wearing. That is definitely the goal, to where we can somewhat go back to regular society. But that's going to take time. That's going to take time. You can't rush it. Rushing it is only going to make everything worse, and it's going to take even longer to get everything under control. So, once again, next, I'm very excited, if you can't tell, for next show, because I really do want to do a show on vaccines. But first, we're going to do a little bit more research, me and Sherman, and because there are some recent breakthroughs that have came up in the news. That one vaccine from the business that I can't pronounce. The drug company is
Pfizer.
There it is. That's the one. That's the one that got, what was it? What percentage
90
rate was that? 90. Okay, it was 90. I had to double check.
90% effective, they say.
Mm-hmm. Which I would like to give our viewers some perspective on that number. So, like, what are some other vaccines and what are their
measles
rates?
Is around 90.
Okay. The measles vaccine.
Your flu shot, take a stab at what your annual flu shot is.
Is it like 70?
50.
Whoa.
Yeah.
It's kind of low.
90 is good. And, for a preview of coming attractions, that's exciting, but there are some challenges along with it. And it's it's a little tricky, but the data is good, and we can, there may be more data released by next week, and we can research it and come up with the up-to-date data. But the data that I know looked pretty strong, hence the 90%.
Yep. And I know that there was this one vaccine developed by a place, I believe, somewhere in Quebec, although I'm not 100% sure about that apparently in their phase 1 got a 100% rate of producing antibodies in everybody that got the vaccine. Yeah. Of course, starting in phase 1 now, it's going to take a very long time for that to even come back. But
right.
How long? I mean, now that we have some vaccines that are both close and also starting to make breakthroughs, like how long of a time span does it really take from start to finish for a vaccine?
I mean, depending on the problem, I mean, typically it takes, a year, 18 months to gather all the data, the safety data, the efficacy data, the follow-up data. And if it's good, you then start making it. So 18 months, 2 years even. We don't have that kind of time with this one. So
Right.
They've been kind of, I'm not going to say they're cutting corners, because they're not, but they're overlapping certain phases of it
I see.
to help speed things along. It's a risk, but it's got a big reward if it pays off. But just know that these vaccines that are going quickly are not being the safety data is not being the one that's kind of rapidly. They're allowing enough time to adequately study the safety of these vaccines.
Mm-hmm.
So the safety is not going to be an issue at the end of the day.
That's right. It's always important to remember for any vaccine that prevents a disease that the odds of you getting a complication from the vaccine are going to be lower than getting a complication if you were to get the disease itself. Yeah. And that's why these vaccines are so important, because they always drastically lower the numbers of people getting sick, resources spent on people getting sick, and the people that are dying or have complications, lifelong complications from such diseases.
And they're trying to make the vaccine, and we can talk about this again next week, not only difficult for the person to catch it, but if they did catch it, even difficult for them to transmit it again. So there's a couple of catch it and be asymptomatic and not get affected, but then they don't want to give it to somebody else, so it'll make it difficult for it to be transmitted. However that can be.
Exactly, and because we have confirmed instances of COVID-19 reinfecting somebody with different strains of it, it's very important that we get a vaccine to block the disease from infecting somebody ever again, because of the fact that it can infect people multiple times. People might think they're safe because they had it already, and then they end up unknowingly infecting some people.
Right. And then we may never get out of this thing if you just keep on,
Yep.
So you got to take your vaccine. You got to take the vaccine. I understand the anti-vaxxers out there, I guess, but it's just, the benefit is so good if we can all get on the same page. Exactly.
Not this time. 50, 70 years ago, smallpox was eradicated.
Yeah.
And that could only be done by an international effort to track down all the instances of smallpox around the world, and it was able to be eradicated. And to this day, newly born people don't have to get the smallpox vaccine because the disease is just gone. And so that's really the ultimate goal of vaccines, is to eradicate a disease from humankind. And then there's no issues anywhere.
Yeah.
Right.
Can't be regenerated again.
I think that's a nice place to wind down and end off the show. Was there anything else that you happen to want to mention?
My take-home messages from going back to the theme of the show is to, certainly ask questions to the doctor, ask questions to your computer, ask questions. I mean, a good doctor will take every question that's a good question and help you understand the best way to solve whatever complaints you may have. And the doctor will, tell you, yes, this is a good question, but we don't have to worry about that particular thing. The more you talk about things through and hear and better understand what's going on, the better you can, treat your problems, complaints, symptoms, and come out ahead of them down the road.
Exactly. I would like to give a shout out to one of our viewers, Dana. She had to undergo a surgery today, and she also has lots of other existing conditions that we would like to say we hope she had a speedy surgery and a speedy recovery. And she was concerned about COVID-19 last week, and hopefully we addressed her concern.
Yeah. We are thinking about it tonight.
Yep. If anybody else has questions for us that we couldn't get to during the show, you can always email us at myworldsciencetv@gmail.com. If you happen to be in the LA area and you want to see Dr. Sherman for anything, his email is in the chat, towergastro@gmail.com, and his office phone number is there, 310-659-9600. We do these every Thursday at 5 p.m. PST. So until next week, stay safe.